Xvite 1 mg, 100 mg, 300 mg tablet multivitamins is a combination of B vitamins that are essential for the body. It is used to treat or prevent vitamin deficiency caused by a poor diet, certain illnesses, alcoholism, or during pregnancy. These vitamins are important for maintaining good health and are vital building blocks for the body. The B vitamins in this product include thiamine, riboflavin, niacin/niacinamide, vitamin B6, vitamin B12, folic acid, and pantothenic acid. Some brands of B vitamins may also contain additional ingredients such as vitamin C, vitamin E, biotin, or zinc. It is best to consult with your doctor or pharmacist if you have any questions about the specific ingredients in the brand you are using. The benefits of Xvite 1 mg, 100 mg, 300 mg tablet multivitamins are to help treat or prevent vitamin deficiencies, which can occur due to a variety of reasons such as a poor diet, certain illnesses, alcoholism, or during pregnancy. It is important for maintaining overall good health. The daily dosage for Xvite 1 mg, 100 mg, 300 mg tablet multivitamins should be determined by a healthcare professional and is based on individual needs. It is best to follow the instructions on the product label or as directed by your doctor. There is no specific optimal timing for taking Xvite 1 mg, 100 mg, 300 mg tablet multivitamins, but it is generally recommended to take it with food to help with absorption. It is important to follow the dosage instructions provided by your healthcare professional for the best results. When taking Xvite 1 mg, 100 mg, 300 mg tablet multivitamins, it is important to follow the instructions provided on the product package. If you are taking a brand that contains vitamin C, be sure to take it with a full glass of water unless directed otherwise by your doctor. If you are taking chewable tablets, make sure to chew the tablet thoroughly before swallowing. For extended release capsules, swallow them whole without crushing or chewing to avoid any potential side effects. If you are taking a liquid product, be sure to use a medication measuring device to carefully measure the dose, and do not use a household spoon. Some liquid products may need to be shaken before each dose, and products containing vitamin B12 may need to be placed under the tongue before swallowing. It is important to take this medication regularly at the same time each day to get the most benefit from it. Make sure to follow the label directions carefully to ensure you are getting the most benefit from the medication. If you experience a mild upset stomach or flushing after taking Xvite 1 mg, 100 mg, 300 mg tablet multivitamins, don't worry. These effects are usually temporary and may go away as your body gets used to the product. However, if these effects persist or worsen, it's important to consult your doctor or pharmacist. It's important to note that if your doctor has prescribed this medication for you, they have determined that the benefits outweigh the potential side effects. Many people who use this medication do not experience any serious side effects. While it is rare, a serious allergic reaction to this drug can occur. Seek medical help immediately if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or difficulty breathing. It's also important to remember that the list of possible side effects provided is not exhaustive. If you experience any other effects not mentioned, it's best to consult your doctor or pharmacist. If you're in the US, you can report any side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before using Xvite 1 mg, 100 mg, 300 mg tablet multivitamins, it's important to let your doctor or pharmacist know if you have any allergies to the ingredients. This product may also contain inactive ingredients that can cause allergic reactions, so it's best to talk to your pharmacist for more details. If you have diabetes, liver problems, or vitamin B12 deficiency, it's important to consult your doctor or pharmacist before using this product. Some forms of this product, such as chewable tablets or liquid products, may contain aspartame, sugar, and/or alcohol. If you have conditions like phenylketonuria, diabetes, alcohol dependence, or liver disease, it's important to consult your doctor or pharmacist before using this product to ensure it's safe for you. It's also important to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products, before having surgery. If you are pregnant or breastfeeding, it's important to consult your doctor before using this medication. Xvite 1 mg, 100 mg, 300 mg tablet multivitamins is safe to take during pregnancy, and maintaining adequate amounts of folic acid during pregnancy may prevent certain spinal cord birth defects. While there have been no reports of harm to nursing infants, it's still best to consult your doctor before breastfeeding while using this product. It's important to be aware that Xvite 1 mg, 100 mg, 300 mg tablet multivitamins may interact with other drugs, which could affect how your medications work or increase your risk for serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. It's also important not to start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Xvite 1 mg, 100 mg, 300 mg tablet multivitamins include altretamine, cisplatin, certain antibiotics, such as chloramphenicol, certain anti-seizure drugs, such as phenytoin, levodopa, and other vitamin/nutritional supplements. Additionally, this product may interfere with certain lab tests, potentially causing false test results. It's important to make sure that lab personnel and all your doctors are aware that you use this product. When taking Xvite 1 mg, 100 mg, 300 mg tablet multivitamins, it's important to follow the recommended daily dosage and take it at the optimal time for the best results. If someone takes too much Xvite 1 mg, 100 mg, 300 mg tablet multivitamins and experiences severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call 911 or your local poison control center at 1-800-222-1222. Canadian residents should contact their provincial poison control center. Symptoms of overdose may include stomach pain, nausea, vomiting, and diarrhea. It's important to keep all your medical and lab appointments when taking Xvite 1 mg, 100 mg, 300 mg tablet multivitamins. This product is not a replacement for a balanced diet, so it's essential to remember that getting your vitamins from healthy foods is best. B vitamins can be found naturally in leafy greens, vegetables, meat, fish, poultry, and enriched breads/cereals. If you happen to miss a dose of Xvite 1 mg, 100 mg, 300 mg tablet multivitamins, take it as soon as you remember. If it's close to the time for your next dose, then it's best to just skip the missed dose and take the next one at your regular time. Avoid taking double doses to make up for the missed one. Make sure to check the storage information on the package and ask your pharmacist if you have any questions. Keep this medication out of reach of children and pets. Do not flush this medication down the toilet or pour it into a drain unless instructed. Make sure to properly discard the product and it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.